previous video we had completed till the drug nalidixic acid, which we knew which was first discovered in 1963, which had the naphthythyridine scaffold and the 3-carboxylic acid, which was predominant in treating the urinary tract infections caused by the gram-negative, and the active metabolite of it is 7-hydroxy methyl metabolite, which was significantly more active. Then after nalidixic acid we had all the semi-synthetic fluoroquinolines, which effectively was used in the urinary tract infections, and from that we had the three conditions that were applied. So let's see the first drug in this. So norfloxacin is the first drug we had as a semi-synthetic fluoroquinoline, in which you can see there are three conditions applied in the IUPAC name itself. 6 fluoroposition substitution we needed, so it has 6th fluoroposition, 1 piperazine ring, so yes, piperazine ring, 7 piperazine ring, which is attached to the first nitrogen atom, and 3 quinoline carboxylic acid. So the conditions where there should be 3 carboxylic acid, 6 fluoro substitution, and the 7th 8th position पर there should be an piperazine ring. Okay, now this fluorine atom due to this gives the increased potency, and it is used in the and it improves the anti-pseudomonal activity. Okay, which is again, as we are studying about UTI agents, so it will be prominent in treating the urinary tract infections. Okay, you can see the marketed product I have displayed here, how it comes, and it is also used in the treatment of uncomplicated gonorrhea. Let's see the next drug, that is enoxacin. Enoxacin, now we have enoxacin is nothing but metabolized largely by the cytochrome P450 enzyme, which has a relatively short elimination of half-life. You can again see there is a piperazine ring, 6 fluoro substitution, and a 3 carboxylic acid, which is satisfying the conditions in order to treat the antibacterial agents. The dosing is twice a day, and this forms an insoluble chelate, okay, with the divalent metal ions that are present in the antacids and hematinics. One of the marketed product is Enocare. Okay. The next drug we have is ciprofloxacin, very well known. Okay, now ciprofloxacin and enoxacin, which is the difference is this cyclopropane propanamine ring. Okay, and the other substitutions conditions like 6 fluoropiperazine ring and 3 carboxylic acid are satisfied, right? And these are used in the bacterial gastroenteritis, which is caused by gram negative. These are also used in the respiratory tract infections, okay, like controlling the bronchitis and pneumonia. You have been using for this, right? Bronchitis and pneumonia conditions, but ciprofloxacin is also an effective antitubercular agent. Okay, it is also used for treating or combating the infections of skin, soft tissues, etc. Okay, now we have the combination of the ciprofloxacin with the cephalosporin antibiotic, that is nothing but ceftriaxone. Ceftriaxone is recommended as a treatment for choice of the disseminated gonorrhea. Okay, so generally it is also given in combination, and one of the combination of cephalosporin with ciprofloxacin, that is the ceftriaxone, is recommended for the treatment of dissemination gonorrhea. Now the single dose of the treatment with ciprofloxacin plus doxycycline, that is nothing but a tetracycline antibiotic, can usually eradicate the gonococcal urethritis. Okay, these are again gonococcal urethritis and the disseminated gonorrhea are the disorders related to the UTI. So generally the ciprofloxacin, when given with the cephalosporin antibiotic, it is used in the treatment of disseminated gonorrhea, and when with doxycycline, which is eradicates the gonococcal urethritis. Now, injectable forms are also present of ciprofloxacin, but these are highly incompatible. Now, along with the nalidixic acid, the crystal urea may also be induced due to the uh, when given the drug ciprofloxacin. Okay, let's move ahead to the ofloxacin. Ofloxacin, again, you all can see there is a piperazine ring at 7 substitution, 6 fluoro substitution, and 3 carboxylic substitution. Okay, now wherein you can see there is one more additional substitution which is giving the optimal potency, that is 1,8. If you all remember, this was the 8 and this was the first position. So first and 8th position pe again you have the 1/8 pe again you have the ring. Okay, that is nothing but a oxazine ring. Okay, oxazine ring 1 and 4th pe. Not 1 and 8 pe, 1 and 4, I'm sorry. Yes, you can see on 1 and 4th you have the oxazine ring. Alright, and this ofloxacin resembles ciprofloxacin in the antibacterial spectrum, that is again the broad activity and the greater spectrum. It is approved for the treatment of infections of lower respiratory tract. Okay, ofloxacin and ciprofloxacin are usually heard in the treatment of your pneumonia and chronic bronchitis. Okay, now this has an asymmetric carbon atom, so commercially it is marketed as an racemate. Okay, that is 3s isomer, that is substantially more active. Okay, and it is recently marketed as levofloxacin or levaquin. Okay, then we have the next drug, lomefloxacin. Now lomefloxacin is again a difluorinated quinoline with the longer elimination of half-life, and you can see there is 6 fluoro substitution, piperazine ring at 7th position, and carboxylic acid. LOF 250 is the marketed product. Okay, this is a difluorinated quinoline because there are 2 quinolines present in lomefloxacin. Now I'm sorry for this. Okay. So now this lomef I'm sorry for the inconvenience. Okay, so lomefloxacin has been approved for 2 primary indications. Okay, first it is indicated as acute bacterial exacerbations for chronic bronchitis. Okay, and next is second for the prophylaxis or infection of the transurethral surgery. As I said, all the fluoroquinones which we have heard have been used in the H influenza treatment, chronic bronchitis, streptococcus pneumoniae, etc. And second is the prophylaxis of the gonococcal urethritis or transurethral surgery. Now this also finds applications in the acute cystitis and chronic urinary tract infections that are caused by the gram-negative bacilli. Okay, and again one of the ADR is the phototoxicity. There can be an advanced pigmentation. Then we have sparfloxacin. Now sparfloxacin, you can see the differences in the structure. This is again having a difluoro moiety. Okay, now piperazine ring के साथ you also have your dimethyl groups. Yes, so if we start numbering from your 1, this will be your 2, this will be your 3, this will be your 4, and this will be your 5. So generally at the position 3 and 5 you have dimethyl along with the difluoro, okay, and this is generally a newer fluoroquinone, okay, which is marketed by Zospar, okay, that is sparfloxacin. A longer elimination of half-life, and due to the 3-carboxylic and other fluoroquinol conditions, it is satisfying the antibacterial potency, greater antibacterial potency. Now this parfloxacin is also effective in the lower respiratory tract infections, pneumonia, bronchitis, and also for the pelvic inflammatory diseases like gonorrhea and chlamydia. Okay, it is also used for the treatment of bacterial gastroenteritis. As it is a newer drug, it has a wide range of application, and again the phototoxicity is common. Just remember in nalidixic acid and ciprofloxacin we had the ADR as the crystal urea, but here we are having in other drugs as a phototoxicity. Then we have gatifloxacin. Okay, gatifloxacin is nothing but an antibiotic of the 4th generation. Okay, if what are the, sorry for the glitch, don't know why it's happening. Yeah, so we have gatifloxacin, which is an antibiotic of the 4th generation. The difference is that in this, that we are not having the dimethyl, okay, we are just having the methyl moiety, and here we with the annulated aromatic ring we are having the OCH3, okay, that is methoxyfluoroquinone. It is an antibacterial agent which is given as oral and uh, intravenous administration. It is also bactericidal and it should be used to treat preventions that are proven to be strongly suspected by the bacteria. It is also used in the bronchitis, sinusitis, and community acquired pneumonia and other skin infections. Catafloxacin is also been observed as eye drops. Okay, you can see the marketed product. So it can be also used in the eye related antibacterial infections. Next we have is the moxifloxacin. Okay, so moxifloxacin is a quinoline uh, or a fluoroquinoline antibiotic, okay, which is again showing the bactericidal action of moxifloxacin, which results in the inhibition of enzymes again of topoisomerase 2, that is DNA gyrase, and topoisomerase 4. It is symptoms of overdose include the CNS and gastrointestinal effects like tremor, convulsions, vomiting, and diarrhea. Then we have miscellaneous drugs made too, that is nitrofurans and methenamine. Now let's see nitrofurans. The first nitroheterocyclic compounds that is introduced into the chemotherapy were nitrofurans. Two compounds are there, that is furoni, furoxylidone and nitrofurantoin. Okay.